Hello, my name is Katie Fryman. I'm an MSN student at Eastern Kentucky University, and this is my integrative review. Does telephone counseling, when paired with nicotine replacement therapy, increase smoking cessation rates in adults? So why is tobacco use an important topic? According to the CDC, it is the leading cause of preventable death in the United States, with approximately 480,000 deaths per year. On top of lives lost, approximately $170 billion are spent in direct medical care to those that use tobacco products every year, and approximately $156 billion are lost in productivity. The national smoking rate in 2013 was 17.8%, according to the CDC. The United States Department of Health and Human Services put out Healthy People 2020 in 2010 and addressed tobacco use. Their goal for adult tobacco use is to be down to 12% by 2020. So how could telephone counseling help? 7 in 10 smokers do want to quit smoking, and approximately 4 in 10 have tried to quit in the last year, but were unsuccessful, and that is according to the CDC. Telephone counseling is easily accessed. It can be done at any time, anywhere. It is just a phone call away. There's a live counselor available all the time. On top of being easily accessed, it is very individualized. Each caller will talk to somebody about their own benefits for quitting, their own barriers. They can problem solve with the counselor, and they can set quit dates and get motivation as well. So for this integrative review, I looked at 4 different studies. Each were randomized controlled trials. Study 1 showed nicotine replacement therapy versus nicotine replacement therapy with telephone counseling, and that was over a 3-month period. Study 2 looked at nicotine replacement therapies alone versus nicotine replacement therapies with telephone counseling, with a follow-up period of 3 months and 6 months. Study 3 looked at different levels of telephone counseling, brief, moderate, and intensive, and they were either paired with or without nicotine replacement therapies. It was a 3x2 design. Study 4 looked at nicotine replacement therapy alone versus nicotine replacement therapy with telephone counseling versus nicotine replacement therapy if they were telephone counseling. The results from the studies were mixed. Studies 1 and 2 found a significant improvement in smoking cessation rates with those that used nicotine replacement therapies with telephone counseling than those that did not. Study 3 found that there was an increase in smoking cessation rates with those that used any level of telephone counseling with nicotine replacement therapies. And that was over the short term. When they looked at the 12-month data, those that used nicotine replacement therapy with counseling was very minimally higher smoking cessation rates than those that did not. Study 4 did not find any benefit from using telephone counseling with nicotine replacement therapy. So how can we use this information? Telephone counseling can be beneficial for some patients, especially in the beginning, though it is not for everyone. Additional research on the topic would be beneficial. Each of these studies did not look at a time period of more than 12 months, and none of them used biochemical testing. They went on participants' word alone that they did quit. Proposed intervention: nurse practitioners and primary care providers are in a great spot to just talk to their patients that use tobacco about the benefits of telephone counseling. Many patients may not know what all telephone counselors can do for them. And just if they seem like they're receptive to the idea of telephone counseling, then nurse practitioners and primary care providers should offer them the appropriate phone numbers to call. And this can be done in any office or clinic setting.